Hello guys, so let's discuss the interior triangle of the neck. In the previous video we have discussed the posterior triangle of the neck. Now let's discuss the interior triangle of the neck. So this is the muscle which divided the neck into two triangles, interior triangle and posterior triangle. This muscle is sternocleidomastoid. So the boundaries of the interior triangle, interiorly it is bounded by the midline of the neck. Posteriorly it is bounded by the interior border of the sternocleidomastoid. The base is formed by the body of the mandible. Okay, so this is the interior triangle. This diagram also shown the interior triangle of the neck on both sides. So this is the midline of the neck. This is the posterior border of the interior triangle, and this is the base. So on each side there are two interior triangles. Okay, so this is the interior border, which is the midline of the neck. The posteriorly it is bounded by the interior border of the sternocleidomastoid, and the base is formed by this mandible. Now the interior triangle has four subdivisions, which is formed by the digastric muscle. This is interior belly of digastric, and this is posterior belly of the digastric, and the omohyoid muscle, the superior belly of omohyoid. So these two muscles divide the interior triangle of the neck into four subdivisions. Okay, so this triangle, which is below the body of the mandible but above the digastric muscle, is digastric triangle or submandibular triangle. Okay, submandibular triangle or digastric triangle. Now this is superior belly of omohyoid. Interior to it and posterior to midline is the muscular triangle, while posterior to the superior belly of omohyoid is the carotid triangle. Now the third triangle, which is small one, it is below the chin. Okay, this is called submental triangle. Okay, in this picture the submental triangle is clear. So this is interior midline of the neck. So, and this is the interior belly of digastric. So this small triangle on each side, these are submental triangles. Okay, this is the posterior belly of digastric muscle. This is interior. Above it is the submandibular triangle, while this is superior belly of omohyoid. Okay, interior to it is muscular triangle. This is muscular triangle, while posterior to it and interior to this sternocleidomastoid muscle is the carotid triangle. Okay, so these are the triangles. Now we will discuss the contents of each triangle or each division of the triangles of the neck. Okay, so first we will discuss this triangle, which is muscular triangle, and in the muscular triangle the contents are the four infrahyoid muscle. Okay, infrahyoid muscle are present or located in the muscular triangle. So there are four infrahyoid muscle. Okay, two of them is superficial, while the two of the other infrahyoid muscles are the deep infrahyoid muscle. Okay, so the superficial muscles are sternohyoid. This is sternohyoid muscle, which comes from the sternum and insert on this hyoid bone. Okay, this is infrahyoid bone, muscle, superficial infrahyoid muscle. This is sternohyoid muscle, and the second superficial muscle is superior belly of omohyoid muscle. Okay, so this is the superficial layer, while the deep layer of the infrahyoid muscle also had two muscle. This muscle is comes from the sternum and insert on the thyroid cartilage. This is sternothyroid muscle. Okay, so this muscle is sternothyroid muscle, while above it, which the muscle which comes from the thyroid cartilage and insert on the hyoid bone, this is thyroid muscle. Okay, so these are the deep muscle. Deep muscles are thyroid muscle and sternohyoid muscle, while the superficial muscles are thyroid muscle. Okay, sorry, sternohyoid muscle, this muscle, sternohyoid muscle, and the omohyoid muscle. Okay, so these two are superficial muscle, sternohyoid and superior belly of omohyoid, while the deep muscles are this is sternothyroid and thyroid muscle. All of the infrahyoid muscles are innervated by the ansa cervicalis. So this is ansa cervicalis. Ansa cervicalis comes from the C1, C2 and C3 cervical spine. The C1 cervical spine forms the superior root of the ansa cervicalis, while the C2 and C3 combine to form the inferior root of the ansa cervicalis. Ansa cervicalis nerve, not muscle. These two roots combine to form this nerve, which is called ansa cervicalis. Okay, and it innervates all the infrahyoid muscle except the thyroid muscle, which is supplied by the C1 cervical spine through the hypoglossal nerve. Okay, so the thyroid muscle is innervated by C1, and other infrahyoid muscle is innervated by the ansa cervicalis nerve. Okay, so the ansa cervicalis muscle is present posteriorly to the the posterior belly of digastric muscle. Okay, so posterior belly of digastric muscle. Okay, so this is posterior belly of digastric muscle. It is there is ansa cervicalis. Okay, this is the superior root, and okay, so this is inferior root, while this one is superior root. Okay, and it forms the ansa cervicalis nerve. Okay, it is present just interior to the carotid sheath. Okay, we will discuss about the carotid sheath. So it is interiorly located to the carotid sheath. Okay, so this is about the carotid triangle. Now we will discuss this triangle, which is submental triangle, and in the submental triangle, this is submental triangle, this is submental triangle. It has the submental lymph nodes, it has submental artery and submental veins. Okay, so the submental artery comes from the facial artery. Okay, so this is the facial artery, and it gives a branch which is called submental artery, and it is located in the submental triangle. And this is submental veins. Each of the submental veins continue as it drains into this vein, which is anterior jugular vein. Okay, so this is anterior jugular vein, and then interior jugular vein terminates into the external jugular vein. Okay, so this is the contents of the submental triangle, which are submental lymph nodes, it is not shown here. The submental artery, which is the branch of facial artery. Okay, okay, so and the submental veins, this is the submental veins which continue, or it enters into the interior jugular vein, and this interior jugular vein terminates into the external jugular vein. Okay, so this is about the submental triangle. While the third triangle we will be discussing, this one is submandibular triangle. This is the submandibular triangle, and its base is formed by the two muscle base, not base, floor. The floor is formed by the mylohyoid muscle and the hyoglossus muscle. Okay, now we will discuss its content. So as it is called submandibular triangle, so it has one of the contents, which is the submandibular gland. Okay, submandibular gland. So yes, you can see this is the interior belly of digastric, this is the posterior belly of digastric. Okay, so above it is this triangle, which is, and below the mandible, this is the cut end of the mandible bone. So below it is the submandibular triangle, and it has submandibular gland. It has superficial part and it has deep part, and in between the superficial and deep part there is this muscle, which is mylohyoid muscle. Okay, this submandibular gland also has the facial vein. Okay, this is the facial vein and facial artery. Okay, so it also contains facial vein and facial artery. It has three nerves. One is lingual nerve, okay, which is deep. This is the lingual nerve. Okay, this one is lingual nerve. It also has the hypoglossus nerve, which is the 12th cranial nerve, and it has the nerve to mylohyoid muscle. And nerve to mylohyoid muscle innervate the two muscle. One is the mylohyoid muscle, and the other one is anterior belly of digastric muscle. Okay, but the posterior belly of digastric muscle is innervated by the branch from the facial nerve. Okay, so this is the about the submandibular triangle. It has submandibular gland, submandibular lymph nodes. It has also facial vein and facial artery. It has three nerves: lingual nerve, hypoglossus nerve, and nerve to mylohyoid muscle. Okay, so this is the about the submandibular triangle. While the carotid triangle, okay, the carotid triangle, which is this triangle is carotid triangle. Okay, this is carotid triangle. You can also see it in here. This is the carotid triangle. Okay, posterior to the superior belly of omohyoid muscle. So this is carotid triangle, and carotid, the main content of the carotid triangle is carotid sheath. Okay, carotid sheath. So now we will look into carotid sheath, that what it contains. So the carotid sheath contain the lateral most structure of the carotid sheath is this one, which is internal jugular vein. Okay, so this is internal jugular vein. Okay, this one is internal jugular vein, which is the most lateral structure, while the most medial structure in the upper part is the internal carotid artery. Okay, internal carotid artery, which is this one. Okay, this is internal carotid artery, while this is external carotid artery. Okay, but external carotid artery is not the content of the carotid sheath. It is the internal carotid artery. This is the internal carotid artery, which is located in the carotid sheath. So it is the medial most structure. Okay, in the lower part, it has common carotid artery and internal jugular vein, but in the upper part of the carotid sheath, The common carotid artery divided into external carotid artery and internal carotid artery, and it is the internal carotid artery which is located in the carotid sheath in the medial part, while in between the internal carotid artery and the internal jugular vein, the carotid sheath has four cranial nerve, the last four cranial nerve. So first the glossopharyngeal nerve, okay, so this is glossopharyngeal nerve. Then this nerve which is just lateral to the glossopharyngeal nerve, this nerve which comes downward and then it turns toward the medial side to enter into the submandibular triangle. This is hypoglossal nerve, okay, so this one is hypoglossal nerve. The third nerve is this one which is just lateral to the hypoglossal nerve. This is vagus nerve which travels downward to the neck and the thorax region, okay, so this is the vagus nerve, okay, this is vagus nerve, while the most lateral is this nerve which is spinal accessory nerve which travels to the posterior triangle of the neck, okay. So this is about the content of the carotid triangle. So carotid triangle has carotid sheath, it has internal jugular vein, to the lateral, to the medial it has internal carotid artery, while in between it has four cranial nerve, while the interior relation of the carotid sheath is ansa cervicalis. This is the inferior root of the ansa cervicalis, okay, this is the inferior root, while this is the superior root of the ansa cervicalis. The superior root, as I mentioned before, superior root of the ansa cervicalis comes from the C1, while the inferior root comes from the C2 and C3, and it forms the both of them combine to form the ansa cervicalis nerve. So interior relation of the the carotid sheath is ansa cervicalis, while posteriorly it has the sympathetic chain around the internal carotid artery, okay. So this is all about the carotid triangle. So the carotid triangle, submental triangle, muscular triangle and digastric triangle. Okay, so this is, you can see this is the cut end of the posterior belly of digastric muscle, okay. So the posterior to the posterior belly of the digastric triangle is these structures, okay, the internal carotid artery, the internal jugular vein, and the nerves like spinal accessory nerve, the vagus nerve and hypoglossal nerve, while at the upper border of the posterior belly of digastric is this artery, posterior auricular artery, while at the lower border it has the occipital artery, okay. So these artery, these two arteries, posterior auricular artery which is at the upper border of the posterior belly of digastric, while the lower at the lower border there is occipital artery. So this is about the triangles of the neck, okay. So this is submandibular triangle, this is submental triangle, this is muscular triangle, and this one is the carotid triangle. This is posterior belly of digastric, okay, and this is interior belly of digastric. This is omohyoid muscle which is the superficial infrahyoid muscle, okay. So this is all about the interior triangle of the neck and its content. Thank you.